Welcome back, America, to Sound Retirement Radio, where we bring you concepts, ideas, and strategies designed to help you achieve clarity, confidence, and freedom as you prepare for and transition through retirement. And now, here is your host, Jason Parker.
America, welcome back to another round of Sound Retirement Radio. So glad to have you tune in into this episode. Everybody's favorite topic, insurance. Specifically Medicare. We're going to be covering Chapter 11 of my book. Before we get started, though, I like to renew our minds, and I've got a verse here from Philippians chapter 4, verses 6 and 7. Do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your requests to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus. And then something fun. When are turkeys the most grateful? The day after Thanksgiving. Be sure to visit soundretirementplanning.com and click on episode number 416 for articles, links, and resources mentioned in today's show. In today's podcast, you're going to learn all about Medicare. Medicare is a comprehensive health insurance program that becomes available to most individuals when they reach age 65. We cover topics such as what are the different parts of Medicare, when should you enroll, how much should you budget for Medicare. Insurance often stands out as the most significant expense for those who have successfully paid off their mortgage. Medicare is a good deal once you turn 65, and you're going to want to learn more about it and make the most of it. Next week in Chapter 12, we will explore things to consider when hiring a financial advisor. Chapter 11, Medicare. Optimizing Medicare spending in retirement. 6 tips for people age 65 and up. Healthcare costs are a non-negotiable line item in every retiree's budget. You can always cancel a vacation or sell an RV, but your medications and trips to the doctors are necessities. While you can't reduce healthcare costs to zero, you can optimize your spending by understanding Medicare and the cost structure. Below, you'll find 6 tips to help you optimize your health spending in retirement. Number 1, look for help with Medicare's alphabet soup. Medicare is a complex system with many moving parts, and figuring out the right plan for you can be tricky. Evidence shows that just 1 in 20 people choose the drug plan that minimizes their out-of-pocket expenses. Figuring out how the system works can be a full-time job. Thankfully, many people volunteer their time to help retirees figure the system out. You can find local resources by entering your zip code at eldercare.acl.gov. As you prepare to meet with someone locally, it can help to know the following. Medicare Part A covers hospitalizations, skilled nursing facilities, hospice, lab tests, surgery, and home health care. Anyone who paid into Medicare for at least 30 quarters will receive Medicare Part A without paying a premium. Medicare Part B is most similar to health insurance from an employer-sponsored health insurance plan. It covers doctor's visits, outpatient care, home health care, durable medical equipment, and some preventative services. The standard rate for Medicare Part B is $170 per month as of 2022. Medicare Part D covers prescription drug costs. The average monthly cost is $42 per month, but premiums vary based on coverage. Medigap isn't part of Medicare. Instead, these supplemental plans cover services that aren't covered by Medicare's Part A, B, and D. These are standardized plans with letters A through N in most states that offer a variety of coverage options. You can learn more about the plan offerings at medicare.gov. Medigap plans can help you save money overall, but you need to be careful to find the right plan to fit your needs and the best deal on the right plan. Research from Value Penguin showed that premiums for Plan A ranged from $147 to $784 per month. Medicare Part C, also known as Medicare Advantage, are plans that bundle Medicare Parts A, B, and D into a single plan. Enrollees can opt for a Medicare Advantage plan rather than paying for each part individually. Next, you're going to want to enroll on time. People who are 65 years old must enroll in Medicare Part A and B unless they have a qualified exception. Anyone who fails to enroll faces steep penalties for the remainder of their time in Medicare. Those who do not sign up for Medicare on time will pay a 10% penalty for each 12-month period that they were not enrolled in Medicare Part B. They will pay a 12% penalty for each 12-month period they were not enrolled in Medicare Part D. Those penalties can stack up over time. A person who enrolls 3 years late for Medicare Part B will pay a 30% penalty for life. In 2021, a 3-year late enrollee will pay $221.13 per month instead of the standard $171.10. The average prescription drug plan, Part D, costs $42 per month in 2020. A person who enrolls 3 years late will pay $57.12 per month. Medicare.gov gives detailed information about when each person must enroll in Medicare, so check out the site around age 63 or 64 to determine whether you should enroll. If you already receive Social Security benefits, enrollment is automatic. The Social Security Administration handles enrollment for those people. Everyone else needs to think about enrollment, even those who are still working. If you aren't covered by an employer plan, enroll at age 65. Even if you aren't taking Social Security checks, you need to enroll in Medicare Part A and B at age 65. You can start enrolling 3 months before you turn 65. If you are working, don't assume you have an exemption. People who are covered by an employer-sponsored health insurance plan may be allowed to defer Medicare enrollment, but that isn't always the case. People who work for a company with fewer than 20 employees who are part of a health plan must enroll in Medicare at age 65. Those who work for larger companies should check with Human Resources to ensure that their health plan qualifies them for an exemption. Once you stop working, you need to enroll within 8 months of your coverage ceasing. Number 3, know the deadlines. People on Medicare have options to change their plans once per year between October 15th and December 7th. If your health status has changed or prices have gone up, it is a good idea to research a better plan during this window. Those who are enrolled in a Medicare Advantage plan can change plans between January 1st and the end of March. People who want to switch between standard Medicare and Medicare Advantage plans should not stop enrollment in one plan until they have confirmed that the new coverage has started with the other plan. Number 4, consider total costs. People trying to save money on healthcare costs may often choose the plans with the lowest premiums. And this is a good way to cut costs, but it can backfire. People who have regular doctor's visits or who require medication may see their out-of-pocket costs overshadow premium costs. When you're considering which plan, consider the whole costs, not just the upfront premium costs. The Medicare website makes it easy to compare real costs between various plans. Number 5, seek financial assistance. If you're struggling to pay for prescription drug costs, you may qualify for Medicare Extra Help. This benefit can be worth up to $5,000 per year. If you have limited assets and you have lower income, this assistance can help you obtain the needed medications at a reasonable price. Be sure to keep this resource in mind if your retirement budget is slim. Number 6, ask for reconsideration. If you're someone who has a high income before retirement, then you may be faced with unexpectedly high Medicare costs. Those with incomes above $88,000 or $176,000 for married filing jointly will pay higher premiums for Medicare Part B. The income that Medicare considers is your Social Security income from 2 years previous. Because of this, people who retire after a few years of high earning may see higher premiums unless they request reconsideration. However, Medicare allows enrollees to request reconsideration based on a change in circumstances. Qualifying changes include stopping work, divorce, death, marriage, or loss of income. If you earned $95,000 in your last year of work as an individual single person, but expect to have a retirement income of $42,000, you may qualify for a reduction in premiums. To do this, you must request an IRMA, Income-Related Monthly Adjustment Amount, which can be done through the Social Security Administration. Healthcare and retirement takeaways. Planning for healthcare costs in retirement is intimidating. With out-of-pocket costs rising quickly, many people worry that a limited nest egg won't be able to cover all their costs. But by understanding the Medicare system and regularly evaluating your needs, you can find the coverage that optimizes costs and coverage during your retirement years. If you'd like a more comprehensive conversation on Medicare, be sure to go back and listen to the podcast that I recorded with Dr. Katie Vatava, episode number 231. If you're 65 years or older and you think you're paying too much for your Medicare, maybe you had one of these life-changing events that you could qualify for. And so you're going to want to submit the form SSA-44. I'll include a link to this form in the show notes. You can use this form to request a reduction in your income-related monthly adjustments to your Medicare Part B and Part D.
Information and opinions expressed here are believed to be accurate and complete, for general information only, and should not be construed as specific tax, legal, or financial advice for any individual, and does not constitute a solicitation for any securities or insurance products. Please consult with your financial professional before taking action on anything discussed in this program. Parker Financial, its representatives, or its affiliates have no liability for investment decisions or other actions taken or made by you based on the information provided in this program. All insurance-related discussions are subject to the claims-paying ability of the company. Investing involves risk. Jason Parker is the president of Parker Financial, an independent, fee-based wealth management firm located at 9057 Washington Avenue Northwest, Silverdale, Washington. For additional information, call 1-800-514-5046 or visit us online at soundretirementplanning.com.